If you're preparing for the CCHT or the bonnet exam right now, there's a chance that you may be feeling one of two things. Either you're feeling overwhelmed because you don't know where to start, there's so much information, you exactly don't know where to focus, and you're running out of time, or you've been studying for weeks, even months, but you're secretly wondering, am I ready yet? Because here's the truth that most people discover when it's too late. Most students fail not because they're not smart enough, it's because they studied the wrong way. And today I'm going to walk you through a practical dialysis text study guide that can dramatically change your chances to passing the CCHT or the bonnet exam without wasting time studying random stuff that may not even come on your test. And make sure you stay until the end, because one simple shift in how you study can completely change your confidence and your performance. So let's jump in. First, let's talk about why this exam feels harder than expected. Most people assume if I read enough, I'll pass. So they buy books, they highlight them, they watch videos, take notes, review flashcards, and after doing all that, they feel productive. But feeling productive and preparing effectively are not always the same thing, because these exams are not testing whether you can recognize information. They are testing whether you can recall under pressure, under time limits, under stress, under uncertainty. This is an entirely different skill. Think about sports. Watching basketball doesn't make a person a basketball player, and watching a surgery doesn't make a person a surgeon. So, reading notes alone doesn't automatically prepare someone for a certification exam, because exam performance itself is a skill. And many students actually never train that skill. Before you start studying harder, understand the game you're playing. The first thing I tell students is to study according to the exam blueprint or outline. For example, the CCHT exam is heavily weighted toward clinical and technical content. That means patient care, monitoring, complications, machine operation, water treatment, infection control, and vascular access deserve much more attention than obscure facts you might only see once. Many people study randomly, and this exam is not random. The blueprint tells you where the points are. The CCHT and the bonnet exam, they overlap in several major areas: dialysis principles, patient care, machine operations, infection control, safety procedures, vascular access, complications, monitoring, and technical concepts. But regardless of which exam you're taking, your preparation needs to focus on application, not on memorization alone. Many students ask, what should I memorize? And a better question is, can I really recognize the right answer under pressure? And that's a huge difference, because during an exam, your brain behaves differently. Stress changes performance. Pressure changes recall, and that becomes important later. Now, let's talk about one of the biggest mistakes students make: passive studying. Passive studying feels productive because it creates an illusion of progress. Reading chapter after chapter, highlighting notes, watching videos repeatedly, listening while driving, reviewing information over and over. None of those things are bad, but by themselves, they're kind of weak. Real learning begins when recall begins. Try this. Close your book, grab a piece of paper, and write down everything you can recall of the following topics: water treatment, dialysis complications, access types, machine alarms, and patient monitoring signs and symptoms. Then compare everything you wrote with your study material. You'll discover something fast. The gap becomes obvious. And those gaps are valuable because they reveal exactly where your score may be leaking points. Now let's get to one of the most important ideas in this video. Listen up. Study like it's real. Study under exam conditions. This one principle changes outcomes because most students study under unrealistic conditions. Phone nearby, TV on, checking answers immediately, pausing constantly, studying in short, distracting bursts, no timer, no pressure. Then exam day arrives and suddenly timer is running, no phone, no interruptions, stress is high, heart is racing, completely different environment, and then they wonder why performance suddenly drops. And the answer is simple. You trained under comfort conditions, and now you're expected to perform under pressure conditions. Train the way you will perform. Set a timer, sit uninterrupted, remove distractions, answer questions without checking answers immediately, force retrieval, force focus, force endurance, because exam day shouldn't feel new. Exam day should feel familiar. Here's a simple structure many successful students use. Day 1, review concepts. Day 2, practice questions. Day 3, timed recall exercise. Day 4, weak areas only. Day 5, simulated testing, and then repeat. Simple, not complicated, because consistency beats intensity. You do not need 16-hour study days. You need a system you can repeat. And here's something important. Do not spend equal time on subjects that you already feel comfortable with. That's comforting, not efficient. Attack weaknesses. Weaknesses become points, and points become passing scores. If your exam is only a week or two away, don't panic. Focus on high-yield topics. Study questions around dialysis complications, water treatment, infection control, vascular access, and machine alarms. At that point, your goal is to identify weakness and tackle them quickly. Now let's talk about traps. Students lose point because they read too quickly, they miss keywords, they overthink, they second guess themselves, they change correct answers, they panic after difficult questions. And here's something important. You do not need perfection. You need enough correct answers. That's different. Some students hit a difficult section and immediately think, I'm failing. No, difficult questions happen. Stay calm. Move forward. Don't emotionally react to individual questions. Focus on processing one question at a time. Now, if you want help organizing your preparation, download the free Quick Start guide below. I put together a practical study roadmap to help you prepare more effectively. And inside, you'll also find a practice test with answers and rationals so that you can begin identifying strengths, weaknesses, in areas that need more attention. Download the guide below and use it as your starting point in your preparation. One of the biggest mistakes students make is waiting too long before testing themselves. They keep reading, they keep highlighting, they keep reviewing, they keep studying, and they assume that preparation automatically means readiness. And readiness actually gets revealed under pressure because knowledge feels different when a timer starts. Suddenly, recall matters, confidence matters, focus matters. That's why practice questions are so powerful. Not because they only tell you that you're right or you're wrong, but because they teach you why. Understanding rationals builds judgment, and judgment is what shows up on exam day. Study like it's real. Study under exam conditions. Don't simply study until you feel comfortable. Study until you can perform. And those are two different things. Passing your CCHT or BONENT exam, it's absolutely possible. Students who succeed are usually not magically smarter. They simply prepare differently, they practice differently, they simulate differently. They identify weaknesses, they build systems, and more importantly, they keep showing up. So if you're serious about passing these exams, download the free quick start guide below and start preparing with intention. Inside, you'll find a practical study roadmap and a practice test with answers and rationals to help you identify where to focus your time. You can do this. Stay focused, stay consistent, study like it's real, study under exam conditions, and remember, the more familiar pressure becomes during practice, the more confident you'll feel during an exam day. And remember to subscribe and hit that notification bell, because on my next video, we will start breaking down those outlines. I'll see you in the next video.